Dr. Samiran Panda is an ICMR scientist and he's also the head of ICMR's Epidemiology and Communicable Diseases Division. He's joining us live now. Thank you for your time, Dr. Panda. I want to begin by asking you, what do we know just yet about Omicron? And the big question on everybody's mind is that, are the vaccines that are with us right now that we're using in India and outside of India, does it appear that it's going to help us get protection against severe disease caused by the Omicron variant?
All right. So there are 2 or 3 components to the question that you have posed. First of all, Omicron variant of SARS-CoV-2 infection, the virus which causes COVID-19, we are yet to understand the total clinical picture that could happen following infection. But the initial reports that we have received from South Africa and other countries do not indicate that there will be a severe form of the disease. Of course, if somebody is elderly or somebody has a comorbidity, we don't know what would be the clinical picture in them. However, assumption that Omicron would cause severe disease won't be right, an assumption, because this is a new variant. It is now known globally, and mostly from South Africa, based on the data obtained from there, that it is more transmissible. But any variant which is transmissible does not necessarily become fatal. So,
okay. Dr. Panda, looking at how this disease, has been wreaking really havoc across countries, do you think that we already have the variant in India? There is a possibility that it's just a matter of time before it's detected, but we do have this variant already.
Well, of course, if one sees that the first report was from South Africa, the report was on the 9th of November, and then 24th of November and 26th. During that time, WHO declared this as a variant of concern because of the multiple mutations and the transmissibility. So during that time, many travels have happened all over the world and from and within South Africa. So one would not be surprised if, this variant is detected within India. It's just a matter of time, of course. But it should not necessarily cause a panic because majority of these infections might be asymptomatic or might cause mild diseases.
Yes, I ask you this question because a lot of people are just waiting to hear this bad news of the variant being reported in India. Just to clarify that nothing to be shocked, nothing to be surprised about. There is a possibility that we have this variant in the country already, isn't it?
Yes, I will say that in public health and even at the individual level, we do much better if we get news with its right perspective and if we do not get panicked. Because, the government of India and India as a country is now well poised, drawing upon the experience of the first wave and the second wave, and the INSACOG, which is the mechanism of the platform, to do the genome sequencing and to figure out if there is Omicron. We are well able to detect its presence early, number one, through surveillance and also through sequencing. And the information that we have globally obtained around this variant, we should be able to handle it very well. So I would say that the panic is not going to help us. Secondly, it is the same virus, so we know how does it spread, and COVID-appropriate behavior would help us. For example, use of mask and hygiene, and to avoid mass gathering, which could serve as a super spreading event. That should be avoided, and we should go ahead and get our vaccines.
Yes, Dr. Panda, I want to ask you, because you also are a part of the discussions that are undergoing when it comes to boosters in the country. There is waning immunity. I don't think anybody is in denial about that. What I want to ask you is that you did say there is a possibility that this variant is also getting neutralized with the existing vaccines. Should there not be an immediate rollout of additional doses in India, as you're choosing to call it additional doses and not boosters, at least for the immunocompromised population?
The logic for booster, when we say booster, we are trying to boost up the immunity that has already been formed. And if somebody has not been able to mount enough immunity after the 2 doses, for that individual or for a special subgroup, one could think of, administering a 3rd dose. But the discussion around that should be disjointed from the Omicron, because we do not know yet whether the presence of Omicron would require a vaccine, because we must remember that these vaccines against COVID-19, they are disease-modifying vaccines. They are not infection-preventing vaccines. So if we want to, stop the spread or break the chain of transmission of the virus, then it's the COVID-appropriate behavior which we should focus on.
Yes.
In the meantime, we cannot afford to lose the public health priority and the focus, which requires or demands, covering adult eligible individuals as much as possible and as quickly as possible. At least 80% of the eligible adult population should be covered by the vaccines. And the vaccines that we have been using in India now is Covaxin and Covishield. And Covaxin being a whole variant killed, vaccine platform-based, development, then in all probability, it should be able to, mount a better immunity. But that's all about scientific discussion and conjecture. But
when will we have a decision on boosters and additional doses, sir? When can we expect a decision?
The decision is with, first of all, the advisory group is National Technical Advisory Group on Immunization and the Immunization Division. But this discussion should not take away our attention from the regular vaccination program. And if we have any hesitation or, relaxed attitude towards going and getting our second dose on time, that would be absolutely wrong.
Are you all really worried about the second dose coverage in the country? It's not even 50% just yet.
So that's why it's so very important for the media like yours and everybody in the society, and the community engagement and involvement of the community would do the much needed, the boosting in terms of our enthusiasm to go ahead and get our second dose of the vaccines. Delaying it won't help us at all. So vaccination and vaccination plus initiatives. For
what
example,
is the eligible population, Dr. Panda, for the second dose? Who are these people? How many of them in the country just now who are supposed to get a second dose? They're due and they've not gotten it.
So it's adult individuals. We, of course, cover the healthcare professionals, frontline workers, and those who have comorbidities. And even within the adults, we don't know if somebody has, unrecognized comorbidity. So it's always about the adult individuals. For example, people do talk about vaccination of children, but I would say that the parents of the children, the teachers in the schools.
But how many people, Dr. Panda, have not got the second dose of the vaccine? They're due to get this shot, but they haven't. How many people in numbers?
So absolute number you can always calculate. Now we are about 33 to 35%. We have received the eligible adult in individuals, in India. They have received the second dose. So I would say that our focus and public health priority should be, bringing as much eligible individuals under the cover of second dose of the vaccinations as quickly as possible. And that's 80% coverage should happen.
My last question to you, Dr. Panda. Many epidemiologists all over the world are against travel bans. They say this is not going to stop the infection. In all likelihood, the variant is already in your country. What do you have to say? What is the ICMR's position on this? And what's your understanding of the situation as an epidemiologist?
The travel ban would not achieve what we wish to achieve, because the banning, of course, comes with stigmatization. But if you look into the way things evolved, it's South Africa and their ability to identify the genome sequencing at the earliest, and that's exactly what we are talking about. The early detection through surveillance and sequencing, that is what is required. Because the viruses don't need a passport, and many of the virally infected individuals who have asymptomatic will remain in that, and the spread would happen. So it is much better to know the presence and then try and understand how is the clinical situation evolving. So banning has never helped. What it does is to help buy some time, but if a country has a system in place, it is much better to know how is the infection evolving or getting transmitted in a particular setting, and then knowing its clinical picture in full form. And does it require treatment or home-based quarantine is good enough? All those can be figured out.
Okay.
The more we move ahead with the time.
What about genomic sequencing? Has that increased in the country? Because there was a lot of concern about not much sampling, not much sequencing being done. Just do tell us about the kind of increase that we've seen in sequencing in the last few days, given that this the center has told all states that you must, in fact, surrender at least 5% of the samples. And of course, samples of positive patients coming in from high-risk countries who've tested positive.
Of course. So I will say now India has really ramped up its sequencing, ability and the mechanism. So we should all, have our faith and trust on the system, which has really ramped up. And we are well poised in terms of our ability to sequence. And the RT-PCR tests, which we are using now, and even the rapid antigen tests, they are not going to miss out any infection. There was a panic. So no need of such panics. And I would say that we should all adhere to the, COVID-appropriate behavior, and we should move ahead with our vaccines, and we should not panic about RT-PCR test or rapid antigen test not being able to detect the infection. That's not true.
Okay, so there needs to be no modification to any of these tests? They can detect the Omicron variant?
No, the Omicron variant can be detected through the existing diagnostics that we have now in India, which is being, deployed as a part of the ongoing program.
All right, Dr. Samiran Panda, thank you so much for your time and your perspective on an important story. Travel bans don't work is the word from the Indian Council of Medical Research. Dr. Panda also telling us that both the tests, the rapid antigen test as well as the RT-PCR test, continue to be effective and will detect the Omicron variant if at all it has entered India's shores.